Hi there, this is Liz Royals, and I am Vice President of Communications at CityHealth. Thank you so much for joining us today. Today you've logged on to a webinar where we'll review the findings of CityHealth's 2019 annual report, which was just released last week. We're going to go over how you can ask a question. So first of all, this webinar is being recorded and will be shared afterwards. It's easy to ask a question. 1, you can click the speech bubble to open up the chat box and use the raise hand feature to notify us if you have an issue such as not being able to hear us or see the screen, and then we'll send you a message and try to resolve it. 2, type the text of your question into the chat box and press enter to send it. You can select to talk just to the panelists or change to all panelists and attendees so everyone can see your question. If you're giving us a comment or a question, please just tell us your name and give us your affiliation before asking. So today you're going to hear from Shelley Hearn, who's president of CityHealth. Shelley will give you some background on the initiative and then go over the top findings of our new report. The full data set is now fully available on our website, which you can visit at any time. That's cityhealth.org. Thanks again for joining us, and here's Shelley.
Thank you, Liz. And I should give you a real shout out too, not just for the intro, but really more importantly, getting this national report out, getting the attention that we would hope for, and really making sure that we've had so many different ways to get this word out to city leaders, to the press, to community leaders. There's been a huge amount of interest in the past 3 years as we've been constantly releasing City Health findings and working with so many cities across the country on how to get everybody to gold. Let me give that quick background, and then we'll dive into some of the details. City Health is an initiative of the Beaumont Foundation and Kaiser Permanente. And as I was alluding to, we provide leaders with a package of these evidence-based policy solutions that we believe will help millions of people live longer, better lives in truly vibrant, prosperous communities. And what we do is annually evaluate the cities on the number and strength of their policies. And today, we're talking about the 2019 report on our newest findings and data release. Going to the next slide. What our new report offers is a closer look at what the nation's 40 largest cities have been doing with 9 key policies that are in place that, if in place, our experts have identified that these are what will help residents lead healthier lives and make communities thrive. For each of the 9 policy areas, CityHealth is awarded a city either gold, silver, bronze, or no medal according to the quality of that policy. And then, taking all of those into consideration, we award an overall medal to each city based on how many of the policy medals were earned. The next slide gets us to what those 9 policies in fact are. What we know today is that cities across the country are facing a wide range of critical problems, and that it's cities who have been, many that have been innovating and pioneering in some of the smartest evidence-based responses. What we've done is not an exhaustive list, but we've selected 9 policies that meet our specific criteria. And one is that they're largely under city jurisdiction oversight. And 2 is that these are policies that are backed by evidence that can address these key vital conditions that we know impact health, like housing, like transportation, like the food that you eat. And number 3, these were also selected on a really a scale of pragmatism. There had to be examples of bipartisan support, and it had to have been a policy that's worked in at least one of the big cities out there. These had to be ready for widespread adoption, and truly ones that the evidence showed would have a tangible effect on people's health and well-being. So the 9 policies here: affordable housing, where we specifically looked at inclusionary zoning policies, and that's where as new residences are being built, that a certain share of those developments would include units that were affordable to low and moderate incomes. And we took a look in the laws that were on the books for cities to look at percentage of units that had to be affordable, whether it was a program evaluated for effectiveness, and a number of other criteria. Safer alcohol sales is really dealing with the relationship and the correlation that data has shown that alcohol is associated with, heavily associated with violent crime. And in fact, murder rates, armed robbery, domestic violence, all have a high correlation, and that if you deal with reducing the density of alcohol sales, nothing about eliminating alcohol sales, really just about the concentration of how much alcohol is sold in a certain area, it can have a significant impact on reducing violence. Complete Streets is really about making sure that regardless of your age, regardless of your ability, that as you move around a city, that there are convenient ways of getting around, whether you're walking, whether you're biking, whether you're in mass transit. It really ranges from street lighting to crosswalks, and is a comprehensive policy in place. Earned sick leave is about making sure that employers allow their employees to take time off for illness and injury for themselves or their family members. And we score this based on how comprehensive family members are covered, the size of employer, and along with the number of hours that can be earned. Food safety is really focusing in on what public health departments do so well, which is inspecting restaurants, but it's making sure that that inspection score gets translated and is available right in front of the door for consumers, so that they have a right to know what the score was. They can make decisions on this, and the data has shown that that has a huge impact on really improving the hygiene practices in a restaurant, in addition to lowering actual foodborne illness rates. Healthy food procurement deals with making sure that cities on the property that they own and manage are selling foods that meet nutritional standards. And we score this based on vending machines, on percentages, but it really is about helping make sure that people, whether they're coming to City Hall or a rec center, that actually have the ability to have choices on healthy foods, particularly as we're in the midst of an obesity epidemic. Our other policy is quality, high access pre-K programs. The data shows remarkable evidence that strong, solid pre-K programs are an incredible boost in the health and economic vitality of a community. And we work very closely with the National Institute of Early Education Research, tapping into their 10 research-based quality standard benchmarks that we use to score programs around in the 40 largest cities. Smoke-free indoor air is the policies in place to not only protect non-smokers from the harmful effects of tobacco, but it actually, having those in place, helps smokers themselves with their own exposure and smoking habits. Lastly, number 9 is tobacco 21, and that's simply raising the age of tobacco purchasing from 18 to 21, which has a huge impact on reducing the number of young people who are smoking. And when that's put in place, you are much more likely to reduce a person's long-term addiction to nicotine. And obviously, that helps in terms of reducing disease rates and premature death. So let's move on to the next slide, which is when the drum roll usually starts, and getting us to what you really want to know. And I'm going to cheat a little bit and not tell you what the scores are yet, but get into just the quick how we do our testing. This is a two-step process that CityHealth is focused on. And one is that we score and assess those 40 largest cities and allow ability to compare between policies, between cities, on how they're doing in each of these areas. But an important element I want to highlight is that we don't just score, we also stand by city leaders and work closely in supporting those who want to try to increase their policy status, those who are focused on wanting to get to gold. We are here to provide technical assistance, peer-to-peer leader mentoring, helping bring in gold cities to work with other cities on what worked for them, lessons learned and insights, and a number of other ways to help encourage all cities to make it to gold. The scoring system specifically, and this is the next slide looking at the 3 core steps, the way that we've created these metrics is to work with leading national issue experts to actually set up the specific criteria for gold, silver, bronze, and no metal. We have an extraordinary team of lawyers at Temple Law who have worked with us to not only collect all of the executive orders, legislation, executive orders, number of pieces, laws that would be relevant on these 9 policy areas, and those are coded and compared to make sure not only are we getting those assessments right, and putting those into the database that you are going to be able to see. And then third, we have provided all of this data out to each of the cities to make sure that they have an opportunity to check in on the accuracy and quality of those data sets. We, if you think about it, it's over 400 data points that we are gathering and presenting to you, and we want to make sure that everyone has an opportunity to check those and have them be of the best of quality. Part of who works with us in order to help make that not only what those criteria are and making sure they're right, but we've worked with leading public health departments in the country. I mentioned NEAR, Change Lab Solutions. A number of key groups have been critical subject matter experts for us in getting these scoring systems right. The next slide gives the overarching piece in terms of how we determine what the overall metals are of gold, silver, and bronze. In order to get gold, a city doesn't have to get all 9 policies at gold status. It has to receive 5 gold medals in at least in those 9 policy areas. In order to get silver, the city has to have 5 either gold or silver medals in each of the across the board of the 9 policies. And lastly, to get bronze, it requires a medal in at least in 4 of the policy areas. So now, as promised, the 2019 key findings. If you put up the score of the 40 cities, what you'll see is that we have 8 gold medal cities, we have 8 silver medal cities, and 14 bronze medal cities. This is, we've been watching now and scoring for the past 3 years, an amazing trajectory. We've had San Antonio, San Francisco, and Seattle have now joined the other 4 overall gold medal winners of the past, Boston, Chicago, LA, and New York. Unfortunately, this leaves us with 10 cities that do not have an overall medal. But a real applause in what we've seen, and I'll highlight this on the next slide, we've had 10 cities that have moved up in their overall metal status. And it's really an extraordinary achievement in these cities. A lot of hard work, a lot of commitment by many city officials, and it's a real change from 2017 when we first did the CityHealth scores, and the majority of cities did not earn an overall medal. It's a true commitment, and I can hear the applause happening across the country. This next slide, just to highlight, in 1 year from 2018, we actually saw 35 policy changes take place in that 1 year period. 35 new medals have been awarded into these cities that again reflect deliberate focus on how to do policy improvement and shift. And what the next slide will show is the areas in our policy arena that have made the most progress. So, for instance, affordable housing, we have 13 cities have received a medal, which is, while housing is a significant and growing problem in this country, it's maybe one of the thorniest and most complex policy solutions. We've not had as many cities make progress there. In contrast, earned sick leave, we have 23 cities that have received a medal. We have some that have extraordinary maturation, like smoke-free indoor air, where 37 of the 40 cities have received a medal and have made significant progress there. That's true also with complete streets and an amazing investment in capacity there. So what I'd like to do is turn this back to Liz and open this up for any specific questions and issues that you'd like to raise. We're here to discuss. If there's specific questions, we'll follow up with you. But Liz, if I can pass the baton back to you to follow up with questions.
Thanks, Shelley. Okay, so just one more time, I'm going to go over the directions of how to ask a question. So you can click the speech bubble to open the chat box, or use the raise your hand feature to notify us if you're having an issue. You can type the text of your question into the chat box and press enter to send it. You can select to talk just to the panelists or to all panelists and attendees so that everyone sees your question. Please just tell us your name and your affiliation before you ask your question. Okay, our first question is, Shelley, how can advocates use this information to work with city leaders in their community?
Well, there's so many ways that can happen, and it's one of the exciting things that we've seen with just 3 years of data in CityHealth is the extraordinary range of ways that community leaders, advocacy organizations, members of the public have used this data. In some instances, it can be as simple as taking the data set, and in your city, where there may not be a medal or only a bronze medal, information can be gathered as to what other comparative cities, what other peer cities have been doing and have been doing potentially better, and curate that information to take to policymakers and say, look, we're having a problem with teenage smoking rates or vaping. And what we've seen from the CityHealth data is X number of cities have put in place Tobacco 21, which covers electronic cigarettes and vaping. And using that data to show, as part of the evidence base and part of the case making, as to why this would work, why it's a good idea, and it's following the lead of other respected peer cities. In other instances, it's been used by national organizations and put together on this collective kind of big picture information to then help match up cities who have done it with those who have not, and help from either city to city efforts or as part of a national campaign. We've seen extraordinary advocacy take place by city officials themselves, because I think it's important to recognize advocacy can happen in so many different ways, where the health commissioner can take this and help push and be the champion, the chief health strategist, and moving and advancing this internally in an administration to get buy-in, commitment, and support to getting to gold. So we've seen advocacy at pretty much every level, from grassroots to grass tops, leaders inside and out, and it's a database that's here to both be informational, but we're also ready to help and support and work with anybody who wants to try to help get their city to gold.
Okay, our next question is from Harry Hyman. What are CityHealth's plans regarding meaningfully integrating health equity into your policy analysis and choice of policies? And Harry Hyman is from the GSU School of Public Health.
I love that. So equity was, it's actually not simply the people in the public health space that are focusing about the challenges that we have in the health disparities and creating greater equity in this country. We have seen in working with city officials growing recognition that in order to prove health for all and to have better, more equitable outcomes, that we need to address these vital conditions of how we live and thrive in cities. We've got to focus on housing, transportation, access to food, those key drivers and determinants. And that's where the evidence is saying it will make the biggest difference on creating health equity, but it's also where we know the policies can be the creating that fairest level of conditions for everybody. So our original structure in how we determined and selected these policies was done with a framework of taking a look at a policy from each of those key determinants, which have gone through an equity analysis, which have looked for what's the evidence of greatest health impact, and particularly addressing those most vulnerable. And that is where we've started with this 9 policies. It is not the be-all and end-all, but it is a beginning building blocks of pragmatic policies that we know city leaders can do, that we are intending to also expand in 2021 as we see cities maturing on these policies, to take it the next stage and to continue to push as policy as a prescription for addressing health equity.
Okay, great. Our next question is from Dawn Bradley from the Duke School of Medicine. Do you anticipate looking at cities with smaller populations? And if so, how does the methodology change, if at all?
It's a great question. We have actually done a series of analysis to take a look at how do these policies, which were initially selected for the largest metropolitan areas in this country, how they would apply to smaller, mid-size, smaller-sized cities. Working in partnership with public health advocates, a series of focus groups were conducted with officials from those smaller and mid-sized cities to get an understanding of how these policies applied to them. And the how the policies applied to them. Did they see it as relevant? Would they be able to incorporate this into their policy jurisdiction? It was remarkably favorable. There has been so much interest from other cities that we actually, with support from the Robert Wood Johnson Foundation, have created a pilot program to open up CityHealth to smaller, mid-sized cities that would like to participate. We are just now taking and working with volunteer cities, a number of them from really all stretch of the country, heartland, the coasts, from the south, and looking at what would it take, how hard is this assessment to do. We are open to any other cities who are interested to come and work with us in terms of how to make it easy for those cities, in addition to how to help them get the support and attention that they're interested in as they step up in engaging as policymakers and leaders in this area.
I just want to echo what Shelley said and say that we are currently seeking new candidates for an opt-in program for cities that are not in our current 40. And so if you are interested in having your city enter the CityHealth assessment opt-in, we're going to show some contact information on the last slide for our National Director of Partnerships, and you can get in touch with her and she can put you in touch with the correct people. Her name is Katrina Forrest. All right, our next question is from Vishnu Nepal, and is curious about revisiting the policy criteria and whether CityHealth will be updating it to match the latest research on new indicators, and is especially interested in food safety.
So I appreciate that question, and that is absolutely something that we are preparing to do and are in the midst of for 2021. When I had mentioned CityHealth started scoring in 2017, the policies were identified through a extensive process and review of the literature in a policy advisory committee that helped hammer out and select those policies based on what would be workable with city leaders and community interests. We made a commitment that those policies will be in place for 5 years so that cities have a chance to go through that laborious process to get new policies in place and improved. It takes a long time to create that momentum, political will, and support. And that every 5 years, we will go through a process to review what policies should be on the books in that CityHealth package, and what are the criteria that we will use to score gold, silver, bronze, or no medal. We are committed to doing not only expansion of our policies in 2021, so because of considerable interest from city leaders, we will be adding a policy in the area of climate sustainability. We are revisiting the area of substance abuse and mental health. We are revisiting housing to expand to cover the challenges of quantity of affordable housing and the quality of housing that does exist, particularly rental market, and the challenges of homelessness. Food safety has been raised by a number of cities, and in particular there is an interest that as the actual inspection methodology has improved and new standards are evolving at the federal level, that we factor in the actual inspection process in addition to, right now, we focus on how that information is reported to the consumer and front-facing. We are listening to cities, and we'll go through a extensive review of all metal criteria. The food inspection, restaurant safety issue is one that's on our radar too, and one that will get considered as we, again, update and modernize these standards for 2021.
Okay, we have a follow-up question from Don Bradley at the Duke School of Medicine. What proportion of the policies are blocked by government preemption? And for those of us interested in rating smaller cities, do you have any training on performing the survey?
So your first part was about preemption. And for those of you who are not aware of this issue, preemption is focused on federal or state authorities taking away the home rule, the ability of a city to create higher or lower standards on specific policies or putting that policy into place. Preemption can be what we would call a double-edged sword. So, ironically, preemption has been a boon to many of our cities where states have put laws in place saying, California as an example, that the smoking age will be raised to 21. So all cities must do that. They cannot have lower standards. The flip side is on these set of policies, which in general should be under a city jurisdiction, there are some states that have blocked and are preventing cities from implementing the city health policies, which we know will make improvements on the health and vitality of their communities, but for a variety of reasons, states have prohibited that policy from that authority with the city. We have been working on putting the data together. We're looking forward in February of next year, a report will be released by the de Beaumont Foundation that is working in collaboration with National League of Cities and is conducting an analysis of how preemption has impacted city health policies in the cities and some specific health outcomes. I would encourage everyone to sign up for our newsletter at cityhealth.org, where we will give a heads up about these reports, even though this is not a city health report, but it will be using our data, and I think will be a real helpful addition to this conversation, an area. Your second question, Don, was the training that's available. CDC has actually been training and providing support to a handful of cities to learn this policy surveillance methodology, which is the technique that our legal team uses to research and assess the policy scores. In our pilot project, we are providing guidance to cities and interested individuals on what information has to be collected, how to code, and that is then submitted to CityHealth, where we do have technical expertise both with our legal team and our researchers to help walk through, better define, kind of hammer through these issues. It's part, as Liz noted, we have this pilot project is a voluntary one, and we are testing it right now. Any city that wants to join, we are thrilled to have, and we will work closely to support them developing that information and having it be as accurate and visible as that city is interested in doing. So we're learning together, but we do have quite a bit of support to help those city officials get there.
Okay, another follow-up from Don Bradley from Duke School of Medicine. Which policies are missing from your perspective, Shelley?
Don is full of some good, hard-hitting questions. He must be a professor at some some top-notch school, I guess. So we're committed to have no more than 10 policies. In 2021, we will be going further, and it will probably be between 12 and 13. And I noted we'll be including issues such as building health into cities, comprehensive plans, climate sustainability. We've been looking at a lot of issues, everything ranging from gun violence to, again, mental health. And ironically, in 2017, we had planned to have 10 policies. That 10th one was reserved for a upstream prevention-based policy to address the growing challenges of mental health and substance abuse in this country. We ended up, much to our frustration, and I think it reflects the challenges and frustration much more broadly. But at that point in time, there was not a clear set of evidence in terms of how to prevent, how to engage upstream that was at the city level to best address mental health, substance abuse. There were issues and opportunities at the federal and state level. So everything ranging from access to naloxone, which is a state authority, and not meeting our criteria for upstream, but it really, we called for greater investments be done in both assuring that access and treatment for mental health and substance abuse were increasingly available. This was a financial issue versus a policy, a law that a city could have on its books. And also that more investment was made on the research side to better look at what would be an addition and help. We are reviewing that current set of evidence today. We will be releasing our reports and our findings down the road as we prepare for 2021. But there will be additional policies in a number of areas that will be coming on board in the near future.
Okay, we have just one last comment from Vishnu Nepal, which is that it would be great to provide feedback on the indicators, either through a survey or in-person meeting. So we want to invite you, Vishnu, and anyone else on the call who has ideas. You can go to our website, which is cityhealth.org, and then /about, and we have the criteria for our policies available on that page. And then we're gonna move on to the next slide now, where you can see the contact information for the head of partnerships at CityHealth. So that's Katrina Forrest, our colleague. Her email address is up there, and you can feel free to get in touch with Katrina and brainstorm and send her ideas. We also have all of our social media options up here. We encourage you to follow us on social media, and then also to sign up for our newsletter, which is at cityhealth.org/join us. If any of you are going to be at the National League of Cities City Summit this week in San Antonio, we will be there. You can meet Shelley and me and the rest of the CityHealth team. We will be holding a booth, and Shelley will also be speaking at the closing session of the summit. So this has been a really thoughtful conversation. We want to thank everyone for logging on today. And if you have any thoughts or questions after we hang up, we encourage you to get in touch with us. So thank you so much for joining us, and we hopefully will see some of you in San Antonio. Alrighty, bye-bye.